Lithotripsy is a medical procedure used to treat kidney stones, which are hard deposits of minerals and salts that form inside the kidneys. The procedure is particularly effective for stones that are too large to pass on their own or cause pain, bleeding, or other health issues. Here's how it typically works. Preparation. The preparation phase for lithotripsy involves several critical steps to ensure the procedure's success. Initially, patients undergo diagnostic imaging, such as ultrasounds or CT scans, which help doctors identify the size, location, and composition of the kidney stones. Based on these findings, the medical team can tailor the lithotripsy approach to the patient's specific condition. Patients are also instructed to fast, usually overnight, before the procedure to reduce the risk of complications during sedation. Additionally, the healthcare provider might discuss the patient's overall health and review any medications to avoid potential interactions. This thorough preparation is essential to maximize the effectiveness of the lithotripsy and minimize any risks. Procedure. The lithotripsy procedure itself is an innovative, non-invasive technique designed to break down kidney stones into passable fragments. It typically begins with the patient being positioned on an exam table that is either partially filled with water or has a water-filled cushion. This setup helps conduct the shock waves more effectively through the body. Under local or general anesthesia, depending on the patient's comfort and the complexity of the case, the procedure starts. Using real-time imaging, such as X-rays or ultrasound, the physician precisely locates the kidney stones. This imaging guidance is crucial as it allows the doctor to target the stones accurately without affecting the surrounding tissue. Once the stones are located, the lithotripsy machine is used. This device generates high-energy shock waves, which are focused and directed at the kidney stones. These shock waves pass through the body and hit the stones with enough force to break them into smaller pieces. Despite the intensity of these waves, they are finely tuned to ensure they break the stones effectively without damaging the kidney or other organs. The process might be repeated several times to ensure all significant stone fragments are adequately shattered. Each session can vary in duration, but typically lasts about 45 to 60 minutes. Throughout the procedure, the patient's vital signs are closely monitored to maintain safety and comfort. Following the treatment, the stone fragments are small enough to be naturally passed through urine over the subsequent weeks, often with the aid of increased water intake to facilitate the process. This method significantly reduces recovery time and discomfort compared to surgical alternatives, making it a preferred choice for many patients and healthcare providers. Post-procedure. Post-procedure care after lithotripsy is crucial for ensuring a smooth recovery and effective elimination of kidney stone fragments. Immediately following the procedure, patients are moved to a recovery area where medical staff closely monitor vital signs and overall well-being as the anesthesia wears off. It's common for patients to experience mild discomfort or pain as the stone fragments begin to pass. However, this is typically manageable with over-the-counter pain medications like ibuprofen or acetaminophen. Patients are advised to drink plenty of water in the days following lithotripsy. This increased fluid intake is vital as it helps flush the stone fragments out of the urinary tract more effectively. Hydration can also reduce the risk of new stones forming. Additionally, patients may notice blood in their urine for a few days, which is generally normal and should clear up on its own. Follow-up care includes a visit to the healthcare provider a few weeks after the procedure. During this visit, the doctor may perform imaging tests such as an ultrasound or X-ray to ensure all stone fragments have been cleared and to check for signs of complications. The doctor might also discuss dietary recommendations or medication to prevent future kidney stones based on the underlying cause identified for the stone formation. The patient's ability to return to normal activities can vary, but most people are able to resume their usual routine within a couple of days. The focus on rest, hydration, and monitoring for any potential complications is key to a successful recovery from lithotripsy. Risks and after effects. Although lithotripsy is a widely used and generally safe procedure, it is not without potential risks and after effects. One of the most common risks associated with lithotripsy is the development of bruising and minor discomfort around the area where the shock waves were applied. This is typically temporary and resolves within a few days. More significant complications, although rare, can include bleeding. There is a small risk of bleeding around the kidney or in the urine. This usually clears up on its own, but in rare cases may require further medical intervention. Infection. Any procedure that involves the urinary tract can potentially introduce bacteria, leading to infection. Symptoms of a urinary tract infection include fever, painful urination, and cloudy urine. Blockage. Occasionally, stone fragments do not pass completely and can block the flow of urine. This condition, known as Steinstrasse or stone street, may require additional treatments to clear the fragments if they do not pass on their own. Pain. While most of the pain is manageable with over-the-counter pain relievers, sometimes the passing of stone fragments can cause severe pain, necessitating prescription pain medication. Patients should also be aware of the long-term effects, which can include the possibility of recurrent stones if underlying issues, such as dietary habits or fluid intake, are not addressed. Regular follow-up with a healthcare provider is essential to monitor kidney health and prevent future kidney stones. After lithotripsy, patients are typically advised to monitor for any signs of complications, including severe pain, persistent blood in the urine, or signs of infection. Immediate consultation with a healthcare provider is recommended if any concerning symptoms arise. By understanding these risks and actively participating in post-procedure care, patients can effectively manage their recovery and reduce the likelihood of complications.
Conclusion.
Kidney stones, while often painful and disruptive, are highly treatable, and lithotripsy provides a particularly effective method for managing stones that are too large to pass on their own. Advances in medical technology have significantly improved the safety and efficacy of lithotripsy, making it a preferred choice for many patients. With a high success rate, this procedure enables the fragmentation of kidney stones into small, passable pieces, greatly reducing the need for more invasive surgical interventions. Additionally, the continuous improvement in diagnostic imaging enhances the precision of the procedure, ensuring that it is both targeted and effective. For those who experience recurrent stones, ongoing management strategies, including dietary changes and medication, can be implemented to minimize future occurrences. Thus, patients facing kidney stones have access to reliable and minimally invasive treatment options that can alleviate symptoms and prevent further complications. In conclusion, kidney stones are a curable condition with effective treatments such as lithotripsy available. This procedure offers a non-invasive solution to break down large stones, making it easier for them to pass naturally from the body. With today's medical advances, patients have access to treatments that are not only effective, but also minimize discomfort and recovery time. It is crucial for those experiencing symptoms of kidney stones to seek medical advice promptly. Delaying treatment can lead to more severe complications such as increased pain, infections, or even kidney damage. Early intervention is key to managing the condition effectively and avoiding more invasive procedures, ensuring a quicker return to health and well-being. Therefore, if you suspect you have kidney stones, it's important not to delay seeking treatment. It might just be a little too late if complications develop.